Healthcare inequality in Wuhan, China during the COVID-19 era 2019 to 2020 by Ariana Cortez. Description: Wuhan is built with 13 municipal cities, 6 suburban and urban areas, and contains a population of about 11 million. It is one of the largest cities in China and is capital of Hubei province, and it was the first to be impacted by the COVID-19 virus in 2019 that spread rapidly across the world. COVID-19. As soon as the spread began, China placed all residents in lockdown to quarantine and decreased the number of infected cases. Public spaces were restricted and hospitals were scarce, which eventually prevented people from medications or any kind of treatment for the virus. Central urban areas had much better access to healthcare and transportation compared to other areas. Since there were uneven health resources, this increased mortality rates and decreased the population of Wuhan, China. People were neglected accessibility depending on the population size of their area, and that led to hospitals admitting very few patients. Inequality in health resources. Regarding the summary on the previous slide, medical facilities were not the best resource during this pandemic. People would experience overcrowding in hospitals and were often sent back home sick, infecting other family members and friends. Staff were overtaxed, and the shortage of hospital beds got worse and worse. Those few patients who were admitted to these hospitals would have huge amounts of money owed due to medical bills. It was a whole community suffering from a virus that was not under control. Doctors and nurses were also severely affected since they would come into close contact with patients. They would often get infected and they earned very little for their work. I quote, less than even poor migrant workers. Unfortunately, various deaths were not recorded during the lockdown. People did not engage outdoors, universities were closed, and the only hope people had was to gain more accessibility and treatment. Accessibility. Although driving was restricted for residents, transportation was provided in some areas by motor vehicles for emergencies. In urban areas, transportation was minimized, and since no one had much access to nearby hospitals, they often had to walk or stay at home if they were infected. Keeping in mind the necessities of people in food, water, medications, and treatment, the community of Wuhan, China faced high levels of scarcity of resources. Resources offered were medical observation, quarantine, sanitation, and disinfection were prioritized. Measures of self-protection, PCR detection kits provided more accurate and faster testing. Wuhan, China did contribute and offered some resources such as the above, but communities also began organizations. The WHO, World Health Organization, contributed to having this virus under control along with HCW, healthcare workers. 2 hospitals were also created in this era for 2,600 people who had confirmed cases of COVID-19. Wuhan did invest in various resources to solve the large population of patients and healthcare resources, so they brought the idea of Smart Health Wuhan. This Wuhan Smart City will be able to provide more technology and facilitate medical treatment to the public. They will also obtain patient medical records, decrease overcrowding in hospitals, and benefit urban areas. Solutions. I believe that providing more organizations focus on healthcare globally could help this issue and many other issues that we are facing due to healthcare inequality. Wuhan, China experiences this virus unexpectedly, and so can anyone. Therefore, it is important to advocate, help, and protect our environment and communities. As global citizens, it is our responsibility to take action and bring attention to these issues. Therefore, we could gather ideas of investing in large organizations, medications, treatments, and other resources. These are the works cited sources. Okay, so the reason why I decided to research this topic based off healthcare inequality in Wuhan, China was because I feel like we all sort of know that the pandemic started in Wuhan, but I feel like I personally never really looked into the people who had to face a lockdown. So I just wanted to come here and advocate for that group of people because they definitely had to go through a very tough situation, especially since they were the first impacted by this whole pandemic, and they really had to face very few accessibility to hospitals, so they didn't really have much transportation or like any sort of resources. And I think it's important as a global citizens that we let these issues be known because it could occur again, and it could occur to anyone or to any state. And it's good to look outside of the US and just take a look at the world around us to see what others have faced and the challenges that other people had to go through.